The past 3 years have witnessed how recurring spikes of COVID infection could wreak havoc on hospitals across the globe. China is a unique case. Medical resources in China, a country of over 1.4 billion people, are relatively inadequate. But authorities say containment and mitigation have won them time and taught them how best to handle large outbreaks.
我们密切跟踪病毒特点。
We have closely tracked the virus, studied the epidemic situation, advanced vaccination and drug supply, strengthened treatment capacity, improved the emergency response. All these factors have set ground for downgrading the management of COVID-19. It is a prepared battle, not a forced reopening.
These preparations were soon put to the test of recent outbreaks. And what came after were criticisms that China was ill-prepared. So how ready is China? The city of Huzhou in Zhejiang province provides some clues. By the time we visited this third-tier city, severe COVID-19 cases remain at peak levels in Zhejiang province. But in Huzhou Central Hospital, which provides health care for some 4 million people in the region, the emergency room seemed in order.
昨天晚上过来的时候
I brought my father here last night. They immediately gave medication and hospitalized him overnight, faster than I expected.
一看嘛，还是挺快的。
Across the country, increasing the number of beds and medical personnel has helped meet the needs of patients like Mr. Chen. Official data shows that ICU beds per 100,000 people in China have exceeded 10, more than doubled from 4.5 in less than 3 years. By the 9th of December last year, the number of ICU nurses also doubled from 100,000 in 2019 to over 220,000, and doctors increased by nearly a third from over 60,000 in 2019 to 80,000. The expansion has continued to accelerate, with hospitals at all levels in China funneling resources into intensive care.
We turned these transferable general wards into ICU wards and equipped them with a lot of breathing machines. Many nurses and doctors from other departments came to support us. The hospital, even the whole society, gives us strength.
Chinese authorities have called on medical alliances to play a role. These are regional networks of hospitals and clinics that provide different degrees of treatment. It means if high numbers of cases push one institution to the limit, another can step in to help. And actually, China has been advancing this tiered medical system over the past years, and it has paid off in serving more patients in a more targeted manner.
之前我们最高峰的时候，我们等待住院的患者
We had more than 200 patients waiting to be hospitalized on the worst day. With emergency triage, we transferred patients to medical institutes within the alliance, which reduces that number to less than 30 within 2 days. Now we have reached a complete balance of inpatients and beds, so that everyone can receive timely and effective treatment.
Some patients with less severe symptoms are hospitalized at community health service centers like this one with basic diagnosis and treatment ability, but luckily they are still under close monitoring of expert-level medics from the Medical Alliance.
We've been making rounds of visits during the outbreak to inspect patients. Once we confirm patients are in critical condition, we will immediately transfer them to high-level hospitals. We also inform community-level medics about the latest treatment plans for COVID-19, such as how to use antiviral drugs to lower the risk of severe infection.
The use of antiviral COVID-19 drugs include a domestically developed brand called Asvodyne, which is now covered in China's updated medical reimbursement list.
We provide small molecule drugs free of charge.
Medicines used to treat symptoms of COVID-19 covered by China's national medical insurance exceeded 600. The daily output and supply of ibuprofen and acetaminophen, two key antipyretic and analgesic drugs, have quadrupled in last December. By the end of last year, a total of over 170 million ibuprofen tablets and 60 million acetaminophen tablets had been distributed to key areas.
And China has been updating its COVID-19 diagnosis and treatment protocol as the virus mutates. The latest version optimizes treatment for severe and critical cases and some specific children cases that are complicated.
The WHO had noted the efforts by China to scale up clinical care for its population at all levels. Even at last mile, healthcare attempts are going all out.
Over the past 3 years, community workers, medical personnel, and volunteers have been working closely together to curb the spread of the virus in both urban and rural areas. And this experience has helped create a system at the most grassroots level to protect residents.
Even the country has shifted its focus from infection prevention to medical treatment. Authorities stress that putting people first, life first, remains at the core of China's coronavirus policymaking. The preparations seem to be having an effect, as the National Health Commission announced on January the 19th that China has passed the peak of severe COVID infection among inpatients, outpatients experiencing fever, as well as urgent hospital visits.
总体来看
China managed to put medical institutes at all levels and of all types into emergency mode in a short period of time. Presently, beds and medical equipment are meeting the needs of patients that require treatment.
No country can boast that it is fully prepared to handle the ongoing pandemic with all the uncertainty that surrounds it. But preparing medical resources, improving treatments, and safeguarding vulnerable population groups in key areas could help stabilize the spread of the virus. China will continue to adapt to the situation, and despite downgrading its epidemic management rules, the government has made it clear that it will not lie down when it comes to COVID-19. Feng, Yilei, CGTN.